Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Risperdal, or Risperidone. It was originally approved for treatment of schizophrenia in 1993, and then in 2003, the indications were increased to treat people who have mania of bipolar disorder. 2006, it was given approval to treat certain autistic problems in children. And in 2007, for schizophrenia and bipolar disorder in children. It's the second drug in the atypical antipsychotic family approved by the Food and Drug Administration after clozapine. But clozapine has a lot of side effects, so it's not frequently used, although it's a good drug. Other drugs in the atypical antipsychotic family, they would include Abilify and Zyprexa, Seroquel, Latuda, Geodon, Invega, and Vraylar. All of those relatively frequently used. If we look at a study from 2013 that rated all of the different atypical antipsychotics, they found that the effectiveness of Risperdal was fourth among all of them. It was about 40% less effective than the clozapine, but 10% more effective than Invega, and 20 to 30% more effective than Seroquel and Haldol and Abilify. But it does tend to be associated with higher levels of prolactin. Prolactin is a substance we'll talk about in a few moments. That's a hormone that your body produces, and it's typically associated with the breast. So it's associated with lactation in women and associated with premature development of the breast in underage children, also associated with more movement disorders. Now, it's used off-label for a variety of conditions, and this is a problem because the drugs have side effects. And unfortunately, they're being used far too frequently. So they're used to treat anxiety and social phobia and behavioral problems and obsessive compulsive disorder and attention deficit hyperactivity disorder and post-traumatic stress disorder and oppositional defiant disorder and agitation in people who have dementia and people who have Tourette's syndrome and have certain tics associated with it, or people who have delusions of parasitosis. They believe that parasites are walking all over the skin. People who have eating disorders or insomnia or borderline personality disorder or substance abuse or alcoholism, and now the drug companies are trying to push the drugs as therapy for depression. But remember, these drugs have certain indications, and beyond there we shouldn't go. Well, if we look at people who are in long-term care facilities, people who are over age 65, 1 in 5 are receiving these drugs. They're taking the antipsychotic drugs like Risperdal, mostly for treatments of delirium. And that's probably inappropriate. The Food and Drug Administration repeatedly says, hey, don't give these drugs to people who are elderly or people who are not appropriate candidates, because the drugs have side effects. So the drug companies go and they have special units to sell to elderly individuals, or the doctors who take care of the elderly individuals. Doctors who take care of patients who have agitation or confusion or hostility, and children who have attention deficit disorder and obsessive compulsive disorder. But the drugs can get people into a lot of trouble. Well, schizophrenia is a relatively limited market. There's somewhere between 0.5% and 1% of the population with the condition. Onset typically mid-teens to early 30s. It's associated with certain genetic abnormalities, abnormal brain chemistry, and the environment. Symptoms tend to come and go. They're not even constant in an individual patient. And unfortunately, we don't have any gold standard for the diagnosis. There's no laboratory test to make the diagnosis. But we know that the symptoms can be divided into positive symptoms and negative symptoms. The positive symptoms are hallucinations and delusions and disordered thinking and trouble organizing thoughts. Negative symptoms are tiredness, lack of motivation, apathy, emotional numbness and withdrawal, lack of personal hygiene. And most of the people with schizophrenia have at least one other medical condition. Medical condition could range from cardiovascular problem, gastrointestinal problem, endocrine problem, respiratory disease. They tend to be smokers, oftentimes obese or with diabetes or high blood pressure, metabolic syndrome, and About 20% of the people make at least one suicide attempt, and up to 5 to 6% actually do commit suicide. But schizophrenia is a relatively small market, so the drug company is constantly looking for other areas where the drug might be used. And they've sort of latched on bipolar disorder, the manic part of bipolar disorder, and this nursing home problem with people who have behavioral issues, aggressive issues. And now about 1 in 5 prescriptions are for children. Amazing amount of sales worldwide, about $20 billion. If we look at mania specifically in the bipolar disorder, it's about 2.5–3% of the population, 6 million individuals, men, women, about the same incidence. Tends to occur usually around age 25. A manic attack tends to last anywhere between 3 and 6 months, the average. Requires at least 7 days in order to make the diagnosis. Depression tends to last a little bit longer, 6 to 12 months. Require at least 2 weeks to make the diagnosis. Symptoms of mania include euphoria, elevated mood, a lot of energy, activity, people who are jumpy or have a wired feeling, trouble sleeping, people who talk fast, talk about a lot of different things, people who are irritated or agitated, have racing thoughts and poor judgment. They do risky things as far as money is concerned, as far as sex is concerned. Treatment for mania could be an atypical antipsychotic like Risperdal by itself, or sometimes in combination with lithium or valproate, or sometimes just valproate or sometimes just lithium. And certainly lithium probably is the peak as far as the benefit is concerned. It has a lot of side effects, but that drug is associated with probably more of the long-term benefits. Well, if we look at how the drug works, how does Risperidone work? It works by blocking the receptors in the brain for dopamine and serotonin and histamine and noradrenaline, and it's metabolized in the system to a chemical known as 9-hydroxy-risperidone, and that's the same thing as Invega. Well, the drug is well absorbed. The peak concentration is about an hour. And if we look at the metabolite, the same chemical that's Invega, well, in most people, it peaks at about 3 hours. In some people, it doesn't peak for about 17 hours. If we look at the metabolism is going to occur in the liver for the most part because of an enzyme known as CYP2D6. That's the cytochrome enzyme. And the product is put out in the urine, about 70% of the chemical, and at least 15% in the feces. The half-life of the drug in the extensive metabolizers, about 3 hours. In poor metabolizers, might last for 20 hours. So in other words, we need to individualize the amount of drug each individual is going to get. Pregnancy causes some problems, especially in the 3rd trimester, as far as the newborn is concerned. Might cause some withdrawal symptoms. Well, probably not a good idea to breastfeed and take the drug, because some of the metabolites of the drug are going to lead to sedation and jitteriness and failure to thrive and some movement disorders in the newborn. The drug can decrease fertility, and these atypical antipsychotics, Risperdal, associated with a significant number of side effects. Side effects with movement. So it can look like a person has Parkinson's disease or seem to be restless or have muscle problems. Somnolence occurs in about 40%. And when you're sleepy, you can have impaired judgment and thinking. Your motor skills aren't the same. You can be dizzy. Anxiety and blurred vision are common. So too are nausea and vomiting and diarrhea and constipation and abdominal pain and indigestion, dry mouth, back pain. About a third of the people are going to have difficulty sleeping, but the drug is used in some people as a sleeping pill. It can decrease your libido because of that increase in the prolactin we mentioned a moment ago. seemed to have an associated increase in the incidence of pneumonia and gait disturbances, and in young boys, about 5%, or 1 in 20, going to develop increase in breast tissue, also associated with a condition known as tardive dyskinesia. These are involuntary, potentially irreversible movement disorders that come with an increased dose, increased duration of therapy. So we like to use the drug only when necessary. These drugs, the tardive dyskinesia symptoms, might be a twitch of the mouth or a twitch of the eyebrow. Those are common abnormalities associated with these kind of drugs. They can occur in about 30% of the people, especially with long-term therapy, and just because you stop the drug doesn't mean those symptoms are going to go away. There's a question about, do the atypical antipsychotics increase the incidence of problems with suicide? And then we know that there's caution that has to be used, especially if a person has some kind of cardiovascular disease. A person's had a heart attack or heart failure or conduction abnormality. Person's dehydrated. That can even lead to orthostatic hypotension. When you stand up, it makes the blood pressure fall down. And then you get dizzy and you can fall. Postural hypotension is a significant issue in a significant number of people. And then there was a black box that was added to the drug 15 years after it came to market, 2008. They said that there was an increased risk of death that they didn't know about previously, especially to elderly people who had dementia and a dementia-related psychosis. Well, if we look at those people who have dementia-related psychosis, the death rate is increased by about 60 or 70%. The death rate from cardiovascular disease, sudden cardiac death, heart failure, or infections like pneumonia. And there are also warnings and precautions necessary because of an increased incidence of cerebrovascular accidents, so TIAs and stroke. And then there's the neuroleptic malignant syndrome. This is a condition where the body temperature increases, the muscles become rigid, the muscles can break down, and that breakdown leads to some myoglobin floating around in the bloodstream that can block the kidney and lead to kidney failure, certainly mental status changes, irregular pulse, sweating. Fortunately, it's very uncommon, but it still may occur. And then there are problems with abnormal increase in the body weight, abnormal blood lipids, abnormal blood sugar levels. So you have to monitor for diabetes. Watch for people who are taking the drug and then all of a sudden have excessive eating or drinking or urination. The hypotension that I mentioned a moment ago can be associated with dizziness and increased heart rate or syncope. The prolactin that's increased, and an increased amount of prolactin that comes from the pituitary gland in the brain lowers the sex hormone. In children, increases the size of the breast, can decrease the libido, lead to impotence, cause amenorrhea, loss of bone mineral density. And interestingly, a third of breast cancers seem to be responsive to prolactin, so it might make the cancer grow faster. At least that's one of the thoughts. And it can potentially lead to cognitive and motor problems. And that can lead to difficulty if you operate heavy machinery or if you drive a car. It can lead to an increased incidence of seizures. And it can alter the blood count. You have to be especially cautious if you happen to have kidney failure and you're taking the drug. And it interacts with a variety of different substances. So you have to be careful if you're taking Tegretol or Dilantin, phenytoin, or rifampin. Got to be extraordinarily careful if you're taking an SSRI, that's a drug like Prozac or Zoloft or Celexa. Caution with alcohol, caution with other central nervous system depressants. Well, the Food and Drug Administration adverse reporting database, just in the years from 2011 to 2018, reported 37,000 serious cases, including death actually associated with about 3,700 individuals, not necessarily cause and effect, but associated with taking the drugs. Total reports of problems was about 67,000 during that time period. And it's thought that only at most 1 in 10 of the drug side effects is reported to the Food and Drug Administration. So you can see that the drug is associated with significant problems. Actually, a Dutch study in 2013, published in the Journal of the American Medical Association, or JAMA, showed that the patients who took less medicine or discontinued the medicine seemed to do better at 7-year follow-up than the group continuing to take the drug. In schizophrenia research in 2017, it showed that a third of the people off the medicine and in remission at 10 years later, especially if they were high functioning and if they were adults. Well, when you look at the studies of the drug and how good the drug are, most of them are funded by the drug companies. So an independent agency like the Cochrane Group looked at the drug as far as calming the agitated and aggressive psychotic patients, and it found that the studies were pretty low quality and didn't really show that they were all that good. And then they also looked at the studies in general for Risperdal and said, you know, these are, again, pretty low quality. And now they have Risperdal or Risperidone in an injectable type that could be given either every 2 weeks or every month. And the evidence for that, again, relatively sparse. And the studies that were done are relatively short term. Now, an interesting study funded by the National Institutes of Mental Health, done in community hospitals, community clinics, not specialized medical centers, published in the American Journal of Psychiatry in 2015, showed that patients who had low-dose drug therapy plus talk therapy plus family support therapy had greater strides in recovery over a 2-year period. So about 3/4 of the people were able to discontinue the drug in as little as 1.5 years versus people who were receiving the standard therapy without those extra supports. Well, anytime we have drugs, we have a lot of side effects. So in 2012, Johnson & Johnson, the maker of the drug, had a judgment against it, later overturned, of $1.2 billion. The suit was over their downplaying of multiple risks associated with the drug, but later that year, 36 states had sued, and they were awarded $181 million because the drug was being promoted for off-label use for dementia and anger and other kind of similar issues, anxiety. 2013, another $2.2 billion settlement for illegal marketing of the drug. So you have to be careful of these kind of drugs, heavily marketed, but significant number of side effects. The dose, the initial dose for schizophrenia is 2 milligrams a day. Target dose is somewhere between 4 and 8 milligrams in bipolar disorder for the mania part. The initial dose is 2 to 3 milligrams a day. The target dose is anywhere between 1 and 6 milligrams a day. It's used in a smaller amount if a person has autism. Well, you start the drug at a relatively low dose and increase. We don't know how long a person should stay on the drug, but we should periodically reassess whether the person still needs the drug. If the person comes off the drug and has symptoms that recur, the drug can be restarted. There's no good evidence about switching from one of the atypical antipsychotics to another. We now have, as I mentioned, an injectable. We have an injectable that lasts for either 2 weeks or another injectable that lasts for 1 month. If the person is going to come off the drug, it should be relatively gradual. It seems that there might be some supersensitivity of some of the dopamine neurons when a person takes the drug. So in order to quiet things down, the drug must be discontinued slowly. The cost of the drug used to be an awful lot of money. Then it became generic. So to take the drug, say at a dose of 3 milligrams a day, the cash price would be about $77 if you went to Costco and $250 if you went to Walgreens. But with a coupon from GoodRx, it would be anywhere between $4 and $59. If you get the brand name instead of the Risperidone, if you get the Risperdal. Well, the cost is going to be a lot. It's going to be about $700 with the coupon, and if you get the injectable, it's about $1,000. So be careful with these drugs. Consider if the drug's really right for you, and it may well be. The drugs certainly have a place in medical therapy, but they're being used far too frequently. You have to remember there are risks associated with these antipsychotics. And remember, just because you're taking the drug doesn't necessarily mean you have to continue taking the drug for long periods of time. Remember, therapy isn't just taking a pill. It's taking a pill and going to the therapist, having talk therapy. There are a variety of other treatment avenues, not just taking a pill. But unfortunately, so many people are just given the pill, come back and see me in a couple months. Well, if somebody gives you the pill, maybe it would be appropriate to ask for a second opinion. Anyway, thanks for watching. I'm Dr. Ken Landau.